right there, right there. So, good evening all. My name is Wendy. This is Stephen.
Hi.
The Family Insurance Shop. So we're located in the Mercy Claremont Hospital out on 32. So we have the lovely day in and day out right now of all the COVID stuff and all the patients walking in and so on and so forth. It's just been absolutely interesting right now. So we would hope that this would be over and done with by now, right? You know, it should be. Fingers crossed. Let's get there. So a little bit about us. This is our carrier portfolio. We represent the majority of carriers in the area. We don't represent every single carrier in the area. Perfect. Should I wait?
Not Humana.
No, we do. Humana, we do.
It's not on there.
Yeah, I'll have to put that logo up there. It was on there, but we do represent Humana. Yeah, you couldn't survive in this industry not representing Humana.
Yeah.
Yep.
They made a big change. I hope it's true. They have, you get a card. A month, $35. Some get 50. But it's reprogrammed each month.
For groceries,
Yeah.
Yes.
Kroger's and Walmart.
Kroger's and Walmart. That could be the grocery or it could be the over-the-counter.
Yeah.
There are a lot of plans now that have that benefit. The majority of carriers do now.
But now it's just monthly. They
Mhm.
reprogram it each month.
Yep.
But on the TV, they've been saying it'll be reprogrammed, whatever you have left over. Like it would keep adding up.
For rolling over, no, it does not roll over.
Well, that's what they're saying on TV.
I know, but we can't believe everything that we hear on TV when it comes to Medicare, I promise.
Well, it's Humana.
Yes. Yes. No, the over-the-counter may roll over, but the grocery benefit doesn't roll over.
Well, it says groceries and gasoline and
All that good
get
stuff,
groceries
yeah.
and
Well, these
Walmart
plans,
and,
they're starting to address the social detriments that go along with health. You know, taking care of yourself in regards to having enough food and making sure utilities are paid and all of those things. So you're starting to see a lot of these extra added benefits be added to the plans. You know, we continue to see that more and more and more every year. Last year, there was one of the carriers that actually had robotic pets. Like you could order a robotic pet, and it's a social detriment in regards to isolation and providing that type of thing. My grandmother has one. She didn't get it through her plan, but she really wanted one. So I said, okay, we'll get her one. She named her. She meows. She does the whole charade.
saves money on food and cleanup.
It does, yeah. The robotic certainly, well, that was the thing. I was the one having to clean it all up. There's only so much time in a day. So we have a very wide, broad carrier portfolio. The team, so Stephen, obviously you met Stephen. He's one of the partners. Myself, I'm one of the partners. That's Max and Lulu, they're our bosses. So they pretty much tell us what we're going to do the majority of the day, especially if we're working from home for the day. That happens. Then literally the official cuddler, this is Emma. This is my baby. She's part of the family. She's my sane, unwind at the end of the day girl that keeps me company. So that's just a little bit about us and who we are. So tonight we're gonna go over a lot of the Medicare most asked questions, right? There's a lot of terminology. There are a lot of things that happen when you're looking at Medicare. They say, you know, oh, you could choose plan A through Z, but you get part A and B. And oh, you could have part C and part D, but that's not the same as plan C and D, right? So it gets really confusing. There's a lot of parts and pieces. So we're gonna go over what the eligibility requirements are, what to do if your Medicare plan is changing this year. That will happen typically year over year. So when you enter this space, it's very similar to employer group, right? Every year you do the re-up and you reevaluate those plans, right? You're gonna wanna do the same thing when it comes to Medicare. These plans do change year over year. The Medicare supplements typically do not, it's just a matter of rate, and we'll get into that. But the prescription drug plans can change year over year. So that's the part that's really important. How to properly evaluate your Medicare options, whether you need both Medicare Parts A and B, right? So some of you may continue to work versus, retire at 65. You may have employer group options still at that time. So it's a matter of do I or don't I? What to do if your Medicare coverage is not adequate. Then a simple approach to Medicare enrollment, because trust me, there are lots of different ways that you can enroll in Medicare. That includes typically over the phone. Typically scheduling an appointment, it usually is 6 to 8 weeks in advance, but a lot of people don't realize you can apply for it right online via Social Security as well. So, and then new options and changes that actually should be saved for 2024, not 2023. So let's just talk about Original Medicare and the basics. So Original Medicare is a federal health insurance program for U.S. citizens and legal residents. It's funded in part by taxes you pay while you're working. So, you get your paycheck, right? And you see all the taxes that have come out. There's that one line, Medicare. You're paying Medicare taxes now for later. And it is individual health insurance. It's very different when you go to the Medicare system. You may be used to being on a plan with your spouse or with your children or so on and so forth. Even if you and your husband are eligible for Medicare, you're going to be on separate Medicare. He's going to have his Medicare, she's going to have her Medicare, and you can end up on different plans as well, based upon what your needs are. So it's no longer a group type situation. Medicare, despite what you hear on television, is not free, okay? It's never free. Like I said, it's not a family health plan. Medicare is not Social Security. The Social Security Administration does administer Medicare, okay? But it is not Social Security and it is not Medicaid. Medicare and Medicaid are two separate federal programs.
Well, who pays for Medicare? I heard it's the Social Security. I never see it on any of your bills or anything.
So you paid Medicare taxes when you worked. Those were taken out. And then if you have to pay a Medicare Part B premium, that gets deducted from your Social Security.
Okay.
If you're not drawing Social Security, then you get a statement, a quarterly statement.
Yeah, okay.
A quarterly bill. Yep. So U.S. citizens and legal residents, like we talked about, legal residents must have lived in the U.S. for at least 5 years in a row, okay, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. Age 65 or older. You can be younger than 65 with a qualifying disability. So if you've been on disability for 2 years, typically you are automatically placed on Medicare after that 2-year period. Any age with a diagnosis of end-stage renal disease or ALS. So Medicare has their own special programs for these individuals. So let's talk about Medicare Part A and Part B. So Part A, you get this little red, white, and blue card, and Part A is for your hospital care. So that's anything that's going to take place as inpatient care, okay? Part B is your medical. So that's for your doctor and outpatient care. So that's your specialist, that's if you have to have a procedure, an outpatient procedure done, anything that you're gonna have done outside of the hospital that you're not admitted for is your Part B. So Part A covers hospital meals and rooms, care in special units such as ICUs, prescriptions and drugs administered while inpatient. Okay, so if you're inpatient, it's Part A that's going to cover those. Operating room and recovery services, skilled nursing, some blood transfusions, and hospice. Part B is going to cover things like your doctor's visits, your preventative visits, including your flu shots, even your COVID vaccines now, so on and so forth. Lab work, including blood and urine tests, any x-rays, MRIs, CT scans, EKGs, diagnostic tests and procedures. Those are going to be covered by your Part B. Physical therapies, occupational therapies, and speech language pathology services. So mental health, durable medical equipment such as wheelchairs, canes, walkers, oxygen, all of those types of things are going to be covered under Part B. And then ambulatory surgery services, ambulance and ER. So anything that you can think of that's going to be outpatient is typically covered under your Part B. So let's just talk about some of the changes to original Medicare for 2024. And then I will touch lightly when we get to prescription drug coverage on 2025 as well, because there are some important things that will happen in 2025 that will have a major impact on the industry in general. So Part A is typically 0 for most people. That's if you have put in your 40 quarter hours, which is generally 10 years. Okay, so if you've worked 40 quarter hours or 10 years, you're gonna probably qualify for premium-free Part A, meaning you won't pay a premium. Now, in 2024, if you don't meet those requirements, the premium is either $278 or $505 each month. And that just depends on how long you or your spouse worked and paid Medicare taxes. Okay? So something to keep in mind, if your spouse has worked those 40 quarter hours or 10 years, you can qualify for Medicare under that spouse as well. So Part A, this is original Part A. This is not talking about any of the commercials or anything, any of the literature you're getting in the mail, none of those things, okay? Original Part A has a deductible of $1,632 that has to be met for each benefit period, okay? Days 1 through 60, it's a 0 coinsurance. Days 61 through 90, it's $408 per day. And then days 91 and beyond, it's $816 per each lifetime reserve day. So, and they define a benefit period as 90 days. So once you've been out of the hospital for 90 days, and if you go back into the hospital, that's now a new benefit period. Part B, this is the one that's kind of important that, yes?
Excuse me, but I can have 1 second.
Yes, ma'am.
If you go back in that time period, it's part of the same.
It's part of the same admission, yes. It's absolutely part of the same admission.
So again, to jump back for the slide.
Sure.
So it was the first 60 days are basically free,
Right, except that $1,632 deductible.
but if in your hospital
But then after that,
for 60 to 90 days, you're paying $408 a day.
so this is why you'll see why as we go through this and we learn a little bit more about original Medicare, it's the reason that you're getting all of these calls, all this literature, it's the reason that Medicare Advantage, Medicare supplements, prescription drug plans, it's the reason all of those things exist, to help minimize that risk and exposure for you. So let's go to Part B. Part B, there is a monthly premium for. So your Part A was premium free, no monthly premium. Part B, you're gonna have a monthly premium for, and the base rate, which is most people will fall within this category, is $174.70 each month. Okay? Now, I need you to remember that's per individual. That's not a husband and a wife each together. So each person has that. So that's to have your Part B. Now, if you don't sign up for Part B when you're first eligible and you don't have a valid reason, meaning you don't have a special election period later on, maybe you weren't working and you didn't have employer group coverage and you just decided, I don't really want to enroll in Part B, I don't need it. When you do enroll in it, you'll pay an extra 10% for each year that you could have signed up for it and you didn't, of whatever the going rate of that Part B is at that time, and that is a lifetime penalty. It does not go away. Okay, so this is why it's really important when you're first eligible for Part B. If you don't have additional credible coverage, it's really important to make sure you do.
That price up there, $174.70, in the recent years, have we been paying a lower cost out of our?
It was $164.90 this year. So this is what it's going to be next year. Okay? If you remember, 2 years ago it jumped, and it was a pretty big spike, And then last year, they brought it back down. The reason it spiked last year is they were trying to account for an Alzheimer drug that was going to hit the market that was going to be extremely expensive. And then it didn't actually make it through trials, so they had to go back and make an adjustment to the Part B the following year. So that's your Part B. Now, there's also what's called an income-related monthly adjustment amount. So remember when I said that's the base rate, right? That 164, or what was it, 174.70 next year, that's the base rate if you're single and you make less than or equal to $97,000. And if you're married, you make less than or equal to $194,000. Once you go beyond that, you're going to pay a different premium for your Part B. And this is based upon your taxes from 2 years ago. Okay? So a lot of people say, well, wait a minute, that was my taxes 2 years ago. I'm now retiring, my income's changing. Social Security does have a form, they do have a method where you can appeal that. And if you're in that situation, just let us know. I can get that form for you, explain what you need to fill out and what you need to send in to have that adjusted. So if you fall into any of these categories, your premium for your Part B does go up.
And income in this case could be Social Security benefits you're getting before you're 65, or
Anything that you
any
would file on your
investments.
taxes, because it's all tax return based.
Okay.
Yep.
Is this based on your taxes? Say I'm turning 65 in January, are they gonna look at 2 years ago?
They're gonna look at 2 years ago and look at that and say, okay, this is what you would be paying. If your income now is less than that, that's where we file an appeal. And it usually takes 2 to 3 months for that appeal to go through. So initially, you will have a little bit of a hike initially if you're above those income levels. And then we get it adjusted through that appeals process. Okay? So cost for Part B. So once you have your Part B has a deductible as well. It's $240. Doesn't sound like a lot, right? For $240 is going to come out of your pocket. After that deductible is met, you're responsible for 20% of Medicare approved amounts for doctor services or any outpatient services. So again, this is one of the biggest reasons that you see and you're getting all this mail and all these calls and everybody wants to talk to you about additional coverage, because 20%, you fall, you break a hip, you get cancer and you need chemo, those different types of services, they can bankrupt someone very quickly because there's no cap. It's not 20% up to this maximum out of pocket. There is no maximum out of pocket. Okay? So items that Part A and B don't cover, okay? We'll get into Part D later on, but Part A and B don't cover prescription drugs unless you're inpatient or it's a Part B drug, okay? Routine dental, vision, and hearing are not covered under Original Medicare. So Original Medicare does not offer these services. They don't offer eyeglasses, contacts, or hearing aids. Long-term care or custodial care. This is a really important one. Okay? A lot of people assume when they go onto Medicare that if they get sick later on and they have to live in an assisted living or a nursing home or something along those lines, that Medicare is going to cover that. Medicare is not going to cover those things. It was not designed for custodial care. It wasn't designed to help people with bathing or dressing or your activities of daily living. Okay, so Original Medicare will not cover that. They care outside the U.S. except in limited circumstances. If you're going to travel the world and have Medicare, get a travel insurance policy. Okay, there's a really good one out there. Anthem carries one. It's called Geo Blue. A lot of people utilize that. Or when you book a trip, a lot of times they'll give you the option to buy additional coverage. So always take that coverage out once you're on Medicare, because you're not really going to have care except in very limited circumstances. And honestly, you have to pay for that care up front and then be reimbursed. So let's talk about Part D, which Part D of Medicare is prescription drug coverage. Okay? Medicare Part D insurance provides coverage for prescription drugs and vaccines. It covers types of drugs most commonly prescribed for Medicare beneficiaries as determined by federal standards. So Medicare themselves says, here's the list, here's the base formulary, you have to cover all of these. And then they say, okay, now you have to cover at least 2 drugs in each therapeutic class in addition. So specific brand name and generic drugs, commercially available vaccines that are not covered by Part E will be covered under your Part D. And then, very similar to your other coverage, this is actually going to be on a tiered formulary structure. So you're going to see Tier 1, Tier 2, Tier 3, preferred generics, preferred brand, specialty, so you will see that. And the drugs are grouped into these tiers based upon their cost. And in general, the lower the tier, the lower the cost. Prescription drug plans may have deductibles as well. And so in a lot of instances, you'll see prescription drug plans, they may be deductible exempt for Tier 1 and 2, meaning the deductible doesn't apply. But when you go beyond Tier 2, the deductible is going to apply. And every plan is different. So every single plan is different. So during the year, you also go through different drug coverage stages when you're in the Medicare system. And this is going to get convoluted, and you're going to look at me like I'm crazy, and you're going to wonder who tracks all this and how does it work. And honestly, we have software that does it all for us. For the simple fact of what you get ready to see, you'll understand why. So you have the deductible phase, right? During a deductible phase, unless those drugs are deductible exempt, you pay 100% of the drug cost until that deductible is met. Then you reach what's called your initial coverage. So up to $5,030 of total drug cost, meaning retail cost of your drugs. Okay? When you've reached $5,030 of retail total cost of your drugs, so that includes what you paid and what they're the overall cost of what they're charging for that drug, you enter what's called the donut hole. You guys heard about the donut hole? Yeah? Some of you, not so much. During the donut hole, until your costs and the manufacturer rebate cost reaches $8,000, so during this window between $5,030 and $8,000 for 2024, it's in there. There is, yeah. It should be in, there should be the charge, there should be a chart in here for you. It's a lot, I know. Here it is, right here. You're welcome. You pay, so between this period and this period, you're responsible for 25% of the retail cost of the drug. Okay? This is where it gets pricey. This is where people that are on Eliquis's or they're on not insulins anymore. Insulins are actually, but the Ozempics, they're not insulins, they're blood sugar controllers. Jardiance's, Ozempics, all of those will put somebody in their donut hole within the first couple of months. So these are those higher end drugs, the biologics, those types of drugs, those drugs that are still under patent, right? And most patents stay in place for 7 years. When they're under patent, that's typically when you're going to see them come into play here, okay? Now, that's 2024, okay? This is where I said I'm going to touch on 2025 very briefly because there's good news that's coming for 2025. For the first time in history, there will be a maximum out of pocket on prescription drugs. And the donut hole will not exist. The maximum out of pocket starting in 2025 will be $2,000. So that's the most for the year that you will pay out of pocket for your drugs. What does that mean? That means in 2025, you're going to see drug plan premiums increase to help compensate for that, right? You're gonna see different tiering structures. You know, we don't know yet. Obviously, we're not gonna be able to see those plans till later on. And these are all hypothetical, but, you know, I've been doing it 17 years. I've been doing it long enough to know where they'll make the adjustments. And that's, you know, you'll see that change. You'll also see on the Medicare Advantage plan, likely, the benefits on those plans will probably change significantly within the medical portion of the plan. Okay? So that's 2025. The good news is, though, if you are on those high-end drugs, it's gonna make a huge and significant difference. We meet with people sometimes that are looking at $6,000, $7,000, $8,000 a year, you know, in drug cost for themselves. So once you've reached that $8,000, then you hit your catastrophic coverage period. And during that period, you pay a very tiny, small copay during that catastrophic period through the rest of the year. This resets every year. So it starts every year, January 1, it resets, and it runs through December 31st. Again, the amount you pay for your prescriptions depends on the stage. So, for example, during that deductible and that initial coverage phase, you know, you may have a drug that you're paying $47 a month for, and then all of a sudden, you hit your donut hole, and all of a sudden it's $350 a month, right? It just depends on the drug and what that 25% looks like. Dollar limits can change each year. We see these two numbers go up every year, but 2025, we'll see a cap, and this structure will dissipate. And then not all plans have a deductible. There are a few plans that don't have a deductible. Many people never reach the coverage gap, which is true. It's about 7% of Medicare beneficiaries that reach their donut hole, okay? So it's not everybody, but we are seeing it more often with the introduction of certain drugs, like the Ozempics, the Jardiances, the Eliquises, those types of drugs. We are seeing it a little more often. And like we said, the coverage cycle starts over on January 1. So, you know, you've heard about original Medicare, prescription drug coverage. Prescription drug coverage is only available through private insurance companies. Medicare itself does not provide that coverage. Okay, it's always going to be provided by a private insurance company. So this is where you start to hear these other terms, and you see commercials, and you get all this mail that stacks like this, and you know, and it just gets overwhelming because you start to hear about Part C, which is Medicare Advantage, and then you start to hear about Medicare supplements. And everyone thinks, oh, well, Medicare supplement is a Medicare Advantage plan, and a Medicare Advantage plan is a Medicare supplement. They're not, they're different. So we're gonna talk about a little bit. So once you have your original Medicare, you have your Part A and you have your Part B. Am I in your way? Can you see? Okay. When you have your Part A and you have your Part B, you have a couple of different options and paths that you can go. So you can get a standalone prescription drug plan, and you can couple it with a Medicare supplement, or you can get a Medicare Advantage plan that includes prescription drug coverage. Okay? So there's two paths. There's actually three, because you could stay with original Medicare and just get a prescription drug plan, but you're really exposing yourself because there's no maximum out of pocket on original Medicare. So we talk about these two different paths. So, you know, this is the card. You're going to get this card, right? The lovely card. And you can go with original Medicare and Part D. That's what we just said. But you're exposing yourself in that regards. Or you can go with original Medicare, add prescription drug coverage, and add a Medicare supplement, or what's called a Medigap. So with Medigap or Medicare supplements, they work with original Medicare. Original Medicare pays first, the Medicare supplement pays second. Okay? They're offered by private insurance companies, and they are based upon state availability. There are 10 plans that are standardized by federal and state law. So this is where I said you'll start to hear, okay, well, I've got Part A and I have Part B, but what's Plan A and Plan B? When you hear the word part, that's original Medicare. When you hear the word plan, That's Medicare supplement. Okay? So 10 plans that are standardized by federal law, they're labeled by letters. Plan A, Plan G, Plan C, Plan F. You'll hear all these plans. And plans with the same letter offer the same basic benefits nationwide, except for in Massachusetts, Minnesota, and Wisconsin. So we're in Ohio, we're good. So a Plan G with company X and a Plan G with company Y are the same exact benefits. They're standardized benefits. They're going to cover the same exact thing. What's going to be different are the rates, the rate increase, the history of the rate increases. They may offer discount programs or additional benefits here and there on some of them versus others, but the base benefits of what's covered is exactly the same in those plans. So they're going to help with Part A, hospital coinsurance, skilled nursing facility coinsurance, Part B coinsurance and copays. So those deductibles we talked about, right? Those are going to be taken care of. Cost of blood transfusions. Typically, they're going to have a 365 extra hospital days included in them for a lifetime. Hospice care, Part A deductible, foreign travel emergency. Again, I'm going to say you're still going to pay for it up front and try to get reimbursed. You're better off having the travel insurance. And then provider charges above Medicare's approved amount. That's what's called excess charges. Ohio is a state that providers cannot charge excess charges. They're not allowed to. Now, if you're from Kentucky, they are. What these plans don't help with. This plan does not help with the prescription drug. Remember, you have to have a standalone prescription drug plan with it. Okay? Routine dental, vision, or hearing are not going to be included in Medicare supplements. There may be some discount programs, but you're not going to find those benefits embedded in a Medicare supplement. Eyeglasses, contacts, or hearing aids, again, custodial care, right? Because in the Medicare system, custodial care is not covered as a basic benefit, or long-term care. So this is pretty much what the chart looks like. It's crazy. It's insane. There's no reason to have to memorize all this, I promise. When the time comes, just make sure you get with somebody who can do a complete evaluation side by side for you, show you all the numbers, so on and so forth. So, but this is what the chart looks like. So A through F, or A through N, and then we've got some high deductible special plans as well. And then Plan F is only available to individuals that turn 65 prior to January 1, 2020?
Yes.
2020, that's right. So if you didn't turn 65 prior to 2020, Plan F is no longer available, okay? The go-to, a lot of people ask me, well, what do most people look at? The go-to seems to be the Plan G. Plan G will cover anything except the Part B deductible. So that $230 next year would be out of pocket, that first $230. And then after that, the Medicare supplement will pick up what Medicare does not. So you must be enrolled in both A and B to be on a Medicare supplement. There's no medical underwriting the first 6 months. Okay, this is where it's really important when you first go onto Medicare to evaluate which direction you want to go. Because after 6 months of being on Medicare, if you want a Medicare supplement, you have to go through medical underwriting. You have a guaranteed issue period for 6 months. Nationwide coverage, and there's no networks. So if the provider accepts Medicare, because Medicare pays first, then the supplement pays second. Guaranteed renewable as long as you pay your premium. Those premiums will increase each year. Okay, you will see increases each year. And they may vary for the same coverage. You may see a Plan G at $98 a month here, or a Plan G at $130 a month over here. What's really important to pay attention to? What were the previous rate increases for those plans? That'll give you an idea. Plans with more coverage generally have higher premiums. And you must continue to pay your Part B premium. So let's talk about Medicare Advantage then. This is Part C. Not Plan C, but Part C, right? It's a part of Medicare. And it combines your Part A and your Part B, a lot of times, most often, includes prescription drug coverage and may offer additional benefits. So Part C is known as Medicare Advantage. Okay? These are the commercials that you see where you hear, free, free, free. You know, they'll pay your Part B premium for you. They'll give you this, they'll give you that, so on and so forth. That's what those commercials are about. So it's another way to get your Medicare, and it's an alternative to original Medicare. So what happens is you have your Part A and B, right? And in this coverage, it's a managed care coverage. It takes over and it manages your care. You don't have original Medicare. You'll always have original Medicare. But Medicare is now paying that organization to administer your care for you, for your Part A and Part B benefits. Good. So you're still in the Medicare program. They're administered by the plan. They're offered by private insurance companies. And most plans offer built-in prescription drug coverage and additional benefits such as dental, vision, and hearing. So all Medicare Advantage plans must be at least as good as Medicare to operate in the market. Their plans have to be at least as good as Medicare. And so you get all the benefits of A, all the benefits of B, and then prescription drug, and then we may be looking at some dental, exams, eyeglasses and contact lenses, hearing aids, and benefits, fitness programs. You hear silver sneakers. How many of you are familiar with silver sneakers? Everybody can't wait to get to the place of having silver sneakers. And these plans are typically either HMOs, right, which are health maintenance organizations, typical, very similar to when you want employer group coverage. You have a network of doctors, you have to choose people within that network to go to. PPOs, meaning you can go in and out of network, but you're going to pay a higher cost share if you go out of network. And then you have POS, SNP plans, and then private fee-for-service and medical savings account plans. There are actually no medical savings account plans in Ohio right now that I'm aware of. There was one, Lasso, it went out of business this last year. So with these plans, you have to be enrolled in both A and B. You can't be denied coverage based on financial or health status, including pre-existing conditions. So when you go through the benefits of that plan and you put your application in, there are no medical questions being asked. You may be required to use provider and pharmacy networks, and the coverage and cost vary by plan and may change each year. To give you an idea, I have a lot of clients in Brown County, and just a lot of clients in Brown County, and they have 107 plans this year in their county. So when we evaluate, we're evaluating 107 plans for them. They have annual limit out-of-pocket costs. So what does that mean? Remember how I told you original Medicare doesn't have a maximum, right? The Medicare Advantage plans have a maximum out-of-pocket, meaning this is the most that you will pay given a catastrophic situation. It may charge a monthly plan premium, and you must continue to pay your Part B premium there. So if we kind of look at this chart and we look and we say, okay, Medicare Advantage, it's going to be low to $0 monthly premium, right? Most often, you're not really going to have a premium. You're going to have a deductible possibly, you're going to have a copay structure, a co-insurance structure, and an out-of-pocket maximum. Prescription drug plans, there's a monthly premium, there's a deductible phase, a copay phase, and there's co-insurance involved. Medicare Supplement, it's a monthly premium, deductible, and there are co-pays involved, possibly, depending on the plan. So I'll give you a couple of real-life examples, right? So this is David, and David chose a Medicare Advantage plan with prescription drug coverage, okay? And he takes one prescription drug. So let's say David, his plan includes preventative care, a fitness program, built-in prescription drug coverage, a network of local doctors and hospitals, and an out-of-pocket maximum of $3,500 per year, right? So he has his Part B premium of $174.70, right? Because you always have your Part B premium. He chose a Medicare Advantage plan that has a zero premium, and he takes a drug, and there's a $15 prescription copay. So on a monthly basis, he's looking at about $189.70, right? But With that being said, he pays co-pays every time he has services, up to his maximum out of pocket of $3,500. Okay? Does that make sense? Yes? No? Okay. So now we'll look at Juanita. Juanita chose a Medicare supplement. Okay? So a little bit of a different structure. So she has her Part B premium, right? That's $174.40. Then she has a part prescription drug, it's $13 a month. And then she has a Medigap Plan G, right? Medicare pays first, the supplement pays second. She pays $120 a month for that. And then she has, oh, I'm sorry, that was the Part D premium, I'm sorry. So she has a prescription drug plan that's $13. And then her prescription, she has one prescription that's a $10 copay. So on a monthly basis, she's looking at $317.40 a month. Okay? So when you think about it, what you really need to think about is do you want to pay up front or do you want to pay as you go? Right? Because that's really what's happening with the Medicare supplement. Medicare's paying, then the supplement's picking up behind it. You're not going to get a bill unless that deductible hasn't been paid yet. You're going to pay your prescription drug plan premium. You're going to pay a copay on your drugs. Medicare Advantage, it was a zero premium plan, but there are co-pays and structure along the way if you do need to use the services. So we're going to talk about enrolling in Original Medicare. So, once you enroll in Original Medicare, then you have to choose one of the, well, you don't have to, but I would highly advise choosing one of the two options in regards to that. But let's talk about when you need to apply for Medicare if you're not there yet. Okay? You want to start the process 3 months before you turn 65. Yes?
No.
No? Okay. You want to start the process 3 months before you turn 65. The reason being, it takes Medicare, it can take them, especially depending on the time of year, it can take up to 8 weeks for them to process those applications. And it's actually not even Medicare, it's Social Security. So you apply via Social Security. You can go to ssa.gov. Easiest way to do it. Easiest. Or you can call Social Security to do it. Yes, or you can call and you can wait and so this is the easiest way. And if you need help with that, if you're not real technologically savvy, we do offer those services to help people. You want to enroll early to avoid those gaps, right? Because there's that 10%. If you don't enroll in time, same thing with prescription drug coverage. If you don't enroll in prescription drug coverage when you're first eligible, there is a 1% per month penalty for every month you didn't take it when you finally do. And that is a lifetime penalty. So I've had plenty of people that didn't take prescription drug coverage. They said, I don't take any prescriptions, I don't need it. And then something happens later on. And I've got clients in their 70s and before you know it, they choose a zero premium Medicare Advantage plan, but they're paying a $64 a month penalty because they didn't enroll when they were first eligible. So, and then there's annual enrollment period. Every year during annual enrollment period, you will reevaluate your coverage if you want to. I would highly recommend it because of the drugs. Every year those plans can change in regards to where those drugs are sitting, what tier they're on, what the copay is for those, even the medical benefits. Now with Medicare supplements, the plan is the plan, right? The only thing that's going to change is the premium. But the prescription drugs, have those evaluated each year just to double check things. And annual enrollment period starts October 15th and it runs through December 7th every year. Okay, so this is when you see the mad rush. There's a few of you that are already on Medicare that say the calls started forever ago and they're getting 30 to 50 calls a day. It's
If you're currently enrolled in all aspects through having already activated Plan B and everything, will it just automatically roll over to the same coverage with a possible price increase if you don't do anything?
Yes, it will. So you don't have to renew your coverage every year, right? You just want to evaluate your coverage every year, but you don't have to renew it. Whatever you enrolled in is going to continue unless that plan gets taken out of the market. So that's one thing to watch. because you'll get what's called an annual notice of change every year. When you're on a plan, you'll get this document, and it'll go over what the changes are. And let's be real, we get all this stuff in the mail from our insurance carriers. I mean, I'm just as guilty of it. You know, we get so many explanations of benefits and all of these letters, and a lot of times people miss it, and sometimes that plan is no longer gonna be available. And they miss that change on their annual notice of change. So you wanna make sure that you at least look at that every year. Even if you throw the summary of, or the explanation of benefits and all of that out, that's fine, but pay attention to that.
And that was required to be.
You should have received them as of September, before September 1st of this year for this year.
So, quick question. If you-
Yes.
Sorry, I heard if you sign up for prescription drugs, as soon as you're eligible to, so as plans change, you can switch prescription drug plans, not face any penalties.
Year over year, correct.
Okay.
Yep.
But you
can-
have to sign up for it.
But you wanna have at least, you at least wanna put something, even if it's minimal,
Yeah.
in coverage. Like right now, there is a plan that's in the market that's $5.10 a month right now. I don't know if that changes next year.
I think there's a zero right
There's a zero premium, this is the first time in history that's ever happened. There's a zero premium prescription drug plan this year. So, I know, right? Raise your hand, like, what's that? I'll take that. I know, right? I mean, I want that deal. So, a lot of people will ask, well, what if I continue to work? Do I need to go on to Medicare? It depends. So if your employer has 20 or more employees, then you can delay your Part B. Okay? You don't have to sign up for your Part B right away. If you're contributing to an HSA and you continue to work, you want to make sure you don't sign up for Medicare A or B because there are tax implications for doing that.
What about if you're under your wife's health coverage?
You can stay on it, it's credible coverage.
Yes,
Does she have more than 20 employees in the company?
yes.
Then yes, then you can stay on it. So what I recommend to individuals that are in that situation, do an evaluation, look at it and say, what am I paying for this coverage now that I have currently?
Right,
And what is it? And what is the deductible?
yes.
And then what are my options over here and how much would I pay for
Okay,
it?
so I really don't have to sign up for A or B as long as I continue to work.
Right, but it is advantageous if you're not contributing to an HSA to sign up for Part A as well because it's premium free. You're not paying a monthly premium for it. And it pays secondary to your employer plan. So it's additional coverage at no additional cost to you.
Okay,
That's hospitalizations.
yeah,
Yeah. So that your employer plan would pay first
yeah.
and then your Part A would pay second. It would help minimize those costs for you.
Repeat that again.
Yep, not a problem. So if there's more than 20 employees and you
Yes.
sign up for Part A,
Mhm.
right?
Yeah.
Part A has no monthly premium.
Yes,
Your employer plan would pay first,
first,
Part A would pay second on hospitals
okay.
stays. So it's additional coverage that you're not paying anything for. Now, if you're contributing to an HSA though, you don't want to sign up for it. And you want to stop contributing to that HSA 6 months prior to going on to Medicare.
Okay, well, I'm not.
Then you're okay.
She does continue to, she is paying into an HSA, and I'm on her coverage.
That means that means you're both paying into an HSA probably.
All right.
She's probably paying an amount into both. So you don't want to take Medicare Part A or B,
All right,
okay? You're gonna need to call Social Security, I'm sorry. That's going to, I know,
No,
it's one of those, but you will need to call them and let them know that you don't want either part,
all right.
okay?
You're saying as long as he's on my insurance?
Is, if there's an HSA component to it, absolutely, yeah. Mhm.
And then once I do decide to retire, do I only have that open enrollment period? Or
No, you will have a special election period at that time, and there'll be a Part B, there'll be a verification form that gets filled out by the employer
so I can
to
just
apply
do
so that
whatever?
you don't have a penalty.
Okay, all right.
Yep.
Yeah,
I
I'm still
work
gonna call Social
part-time.
Security.
Yes, ma'am?
So I get my insurance through Marketplace Healthcare.
Okay, and you're becoming Medicare eligible,
Yes.
so you have to sign up for Medicare. So if you're on the marketplace, if you're Medicare eligible, then you have to move to the Medicare side of things.
Okay, A and B.
A and B, yes.
So you're saying that 3 months before you turn 65, you sign up for A and B
Mhm.
and D?
Well, you want to start with A and B first,
Okay.
and that takes typically 4 to 6 weeks, but sometimes it can take up to 8. Then once you have your A and B, then you start to look at what your other coverage options are and what you need to do.
And that 6 period of time, 6 months period of time, you need to sign up for, or you could get penalized if you didn't have D or something.
D is actually 3 months. The Medicare supplement is what you're hearing, is where you heard 6 months, is where it's guaranteed issued, no medical questions asked for that first 6 months. Medicare Advantage or prescription drug coverage is 3 months from the time you turn 65.
No question. So I'm not ready for this yet.
Okay.
I'm here with him.
Okay.
However, I'm nearing that in a couple of years. I do have an HSA that I'll continue to pay in until I shouldn't. I thought I would just do it until I'm totally retired. But you're saying about 6 months before I,
If you
Enroll.
delay, so if you delay your Medicare, so say you turn 65
uh-huh,
and you decide not to retire,
oh, I'm retired.
you're retired. If
I'm not
you,
working.
you can pay into it all the way up to 65,
Right,
and there's nothing there. There's a lot of people that will continue to work beyond 65,
right.
and those individuals, you have to stop the contributions 6 months prior,
Okay.
because they backdate your Part A 6 months when you apply after you turn 65.
Okay.
I know, it's complicated,
So
I'm sorry.
So for the HSA, I should contribute
Just keep
until
contributing
I'm
to 65, right.
Even though, like 3 months before, I can enroll.
Well, you're gonna enroll, you're not gonna enroll, you're gonna apply for it to start the first of the month you turn
I
65.
see.
Yep.
Okay.
So that's just the application
And someone told me
process.
today, because I just actually open enrolled my healthcare today, the administration told me that I can keep that HSA even after
once you're on
I'm
Medicare.
done retiring,
and
and
you
it's
can-
just my account to pay medical expenses.
You can pay medical expenses, you can pay Part B premiums, and you can pay prescription drug premiums. The only premiums you can't pay are Medicare supplement premiums.
Okay.
I'm still not sure if I'm gonna retire at 65, but I'm thinking about it. So I work part-time, and I know there's a cutoff of how much money you can make over what you get. So say I just wanna work 6 months or something till I reach that amount, and then could I stop working? Like that, and that way they don't hold money back or anything. You know how they say if you make over 21,000 or something, whatever that, what is
She's
it?
talking about Social Security.
Social Security, okay.
I'm
You're talking about drawing Social Security.
Right,
Okay.
I'm trying to decide if I wanna do that and work part-time.
Right, if you don't wait till your full retirement age to draw Social Security and work, you will pay $1 for every $2 that you make in taxes.
But what if I cut my time off at the cutoff?
If you decide to draw Social Security,
Yeah,
they're gonna take $1 for every $2 until you reach full retirement age.
oh, really?
It's once you reach full retirement age is where they no longer take taxes.
So
So
I
you-
can't just work, part-time, for that maximum amount without them penalizing me, can I? That's the part I'm trying to figure out.
Yeah, you're right.
I thought you penalized
Over
over,
$21,000.
once you go
It's
over
like- it's
that,
like
they
22,000.
keep.
Then they keep $1 for every $2.
Okay.
Yeah,
And I'm
$1 for
understanding,
every $2.
Yeah,
The
I recall
2024
Social
number.
Security, you could make, before you reach 65, or your full retirement age, I could make 21,500 before I started getting penalized.
Before you start, okay.
Yeah, once I hit my full retirement age, which is slightly before 67, then I can work
As much as you want.
I don't want to.
Yes. Most people don't, to be honest with you.
I'm tired.
But I know I'm gonna be doing something, so I just wanted to,
Mhm.
Right, so stay
No.
under that limit.
yes, but I don't wanna can I just tell them, okay, I done reached that amount, I'm gonna stop, so you don't have to take any money?
Well, they're gonna notice it from your taxes, because you still have to file taxes.
Right.
And that's what
okay.
they're gonna base it off of, is what you file on your taxes.
Also, okay, so
Yeah.
I don't have to say anything, just keep working and
Just
then
keep
cut it
working
off,
and cut it off yourself, make sure you don't make over that.
and then just,
Yep.
okay.
Yeah, for whatever it's worth, we did have a guy at work, he thought he had to sign up for Social Security, and he continued to work, and he got a bill,
For all the back taxes, yeah.
and
So you're 50%?
now, he got a bill for the entire Medicare premium.
Oh, yeah, yeah.
Yeah.
One thing to remember when you're figuring your income, if you have any investment or interest,
Ooh.
don't forget to add that in.
Or if you're
we get
pulling
back
from a
to-
401k or anything of that
When we
nature.
get back to Medicare, though,
Oh, I'm sorry.
She says, I want to go, you guys, I want to go. So if you have fewer than 20 employees and you're eligible for Medicare at 65, you need to apply for it. So because Medicare is primary in that instance. So under 20 or less, fewer than 20 employees, Medicare is primary. And you will be charged that penalty if you don't enroll when you're first eligible. Make sense? Okay. So late enrollment penalties, like we talked about, Part A and Part B, if you don't enroll when you're first eligible and you don't have a valid credible coverage reason, you're going to pay a 10% penalty for every year you didn't enroll, and that's a lifetime penalty. Part D is a 1% per month penalty, and that's a lifetime penalty as well. So 2024 changes. So you should have gotten your annual notices of change this year. If you're already on a Medicare plan, you should have gotten those by late September at the latest. Okay? If you didn't get your ANOC,
Yeah, if you don't get one, then there is no change? or-
no, if you didn't get one, something happened there and you
Okay.
want to contact your plan and find out
Okay.
where that's at. So, properly evaluating your options each year. You want to make sure you schedule and you prepare for an evaluation. When you want to make a list of any healthcare needs and priorities that are going to take precedence that following year for you. You're going to want to evaluate your budget. That way you're able to determine what type of plan types you want to look at. Make a list of prescription drugs when you're ready to have an evaluation. And if you're considering Medicare Advantage, you'll need a list of healthcare providers as well. Okay, so that the networks can be checked. And then you'll also want to determine whether or not you need dental, vision, or hearing. Because if you go the Medicare supplement route and you need that, then you need to look at a standalone dental, vision, hearing plan. I'm done. I know, a lot of information. Questions, concerns?
If you were working to 65,
Yes, ma'am.
then do you still want to stop your HSA 6 months before that?
No, if you're working to 65, up to 65, you're okay. It's if you work beyond 65,
6 months before
you want to
start
stop at 6 months prior to.
Medicare.
Yep.
Okay.
Because there's not only there's tax implications for you, but there's also tax implications for your employer as well. Yes.
So if you have Medicare A and D and you have a healthcare plan that you took with you from your employment,
Yes.
is there any point in having the Medicare Advantage?
No, so if you have employer coverage and you have Medicare, you cannot have a Medicare Advantage plan in addition to.
Okay.
So that would be where you want to take a good look at, and you also want to take a good look at, if you have less than 20 employees, then you have to have your Medicare, right? And is that the instance?
No.
No, okay.
It was not.
Not
it was
specific.
more- It was government, it was postal point.
Oh, postal employee, so you have federal FEHB. You are a completely different situation, honestly. Likely, you're eligible for a different type of plan through FEHB when you're Medicare eligible that will assist in paying your Part B premiums for you as well. So I would certainly make sure you look at that.
They're telling us there's changes coming. and
Oh.
I don't know.
The post office is telling you that, okay.
That's why I'm here tonight, to
Gotcha.
get an
Okay.
education before I hear about it.
I gotcha, yeah. Well, let's pray that they're
Good ones.
they're good changes, maybe, you know, maybe they're gonna give you more.
When is a supplement really better than the Advantage plan?
Every person is different in regards to their situation, what they prefer. You know, a lot of people, some people look at it and they say, okay, well, to me, that's a waste of money. Other people look at it and say, well, that's safety for me, and that's comfortable for me. Some people don't like paying co-payments, and they just want to pay a monthly premium, they just want to be done with it. And then other people just don't really, it doesn't really matter to them. So every person is very different and unique and individualized in what they want and what they need for their health care.
If you have a lot of co-payments, then the supplement is probably better?
Potentially.
Potentially, yeah. Yeah, especially your first.
When would it be better, you know?
So typically, what you want to take a look at is what are your premiums going to be for your prescription drug plan and your Medicare supplement, and what's that going to equate to for a year, okay? And then you want to look at what's the maximum out of pocket on a Medicare Advantage plan that you would like to be in. And if that maximum out of pocket equates to what you're paying in premiums, then it probably makes sense to stay on the Medicare Advantage route. I can tell you when you first turn 65, typically that doesn't happen until about 72 to 73 years old is when that typically happens.
But that example you gave, they had a copay even on the supplement.
So there's Plan N, and Plan N does have a network of hospitals, and there are some copay structure to it. As a result of that, Plan N is also much less costly.
And the copay you saw in the example was actually on the prescription.
It was
drug
on the
portion.
prescription drug
Because
portion.
the prescription drug portion is not the same as the supplement portion.
Okay.
Yep.
That's even separate.
Yes.
Too many
Yes, ma'am.
separate.
What services do you
Yeah, so we actually, we help anybody with any of these things, as far as applying for Medicare, looking at your options, evaluating all the plans in the county, evaluating the Medicare supplement companies. We also do the underage side as well, if there's a marketplace plan that's needed. We started doing that last year because we had a lot of people retiring at 65, and the spouse was still 61, 62, 63, and needed coverage as well. There's no cost for our services. We are compensated by the carriers. We do get paid the same regardless of what carrier. So there's no bias, there's no incentive for us to put someone in one plan versus the other.
We just need to call you or?
Yes.
So is your information in the packet?
There is a magnet in the packets that has our phone number on it,
And our brochure has it on the
and our
back.
brochure has it on the back as well. Okay? So, and honestly, even if you're not a client of ours and you just have Medicare questions and you just, like you're lost and not sure what to do, slap that magnet on your refrigerator. You can call us anytime. We'll be happy to answer those. Yes, sir.
When you do
That's
evaluations
like,
like
you know,
so.
it always works, that's why I just
If we came in, what would
She
you want to
actually
see?
came to
We would want to see a list of doctors, a list of prescription drugs,
you know, for-
and any medical needs that they need taken care of, and then what plan they're currently on, and their red, white, and blue card.
If they're already on Medicare.
If they're already on Medicare, yes.
Ready?
I didn't get it.
If you don't have anything, we have all this contact information, and so we'll send that information out, so that way you'll have it.
I have business cards as well.